All right, well, thank you, everyone. My name is Michael Seffren, and I'm a co-founder of Soleview, whose main purpose or mission is to help neuropathic diabetics prevent lower limb amputations one step at a time. So the problem is that ulcers and lesions develop on these diabetics' feet, and that can quickly lead to amputations, and sometimes within a few days. Thus, they are instructed by their doctor to inspect their feet every single morning or at night before they go to bed. And these amputations are very prevalent within the diabetic community. In 2016 alone, there was about a $6.5 billion cost to patients and insurers from amputations on diabetic feet. And we think that we have the solution. The Soleview box is a shoebox size box that has a camera inside that kind of transmits an image through a camera to a viewing screen that one can manipulate in front of their face. With our MVP, we put that into my co-founder's clinic, and we got some good results. When asked, does the device aid in seeing the bottom of your feet? We got an average rating of 4.7 out of 5, meaning that, in my mind, that people really thought that it helped see the bottom of their feet. The patients that we're really talking about are elderly diabetics with neuropathy, people who maybe struggle with obesity or arthritis or have bad eyesight, right? All these different comorbidities that come with diabetes. Next slide. So the team is myself. I've got a mechanical engineering degree, and I've been a medical device engineer since about 2014. And my co-founder is Dr. Judith Sperling, who has been a practicing podiatrist for 30 years and also has a very successful YouTube channel, over 100 million views, and she's up to 190 subscribers as of yesterday. The market is fairly large for neuropathic diabetics that are greater than 65 years old, and an assumed device cost of roughly $350. We have a US market of roughly 2.5 billion. And when you look to global, the diabetes problem kind of becomes 10x, whatever that is. So we've assumed that everyone that is over 65 struggles to see the bottom of their feet. And we think that kind of we're positioned appropriately right now because our competition isn't addressing the technology challenges that the elderly have, and also other competition. They're using a method of ulcer detection that I don't think has really proven itself yet, and from what I've read, seems to have some false positives.
Michael, we just got a couple seconds left here.
Okay, and then the business model is very simple: product-based company, and we've done a couple use studies, or we're doing a use study right now, going to a product development, sales testing, product finalization, and then we'll kind of shift. After our launch, we'll shift towards a higher tech medical device option, including some AI and communication with physicians. And that is Soleview. Thanks.
Great. We got about a minute for Q&A. Judges, do you have any questions?
So Michael, it seems like it's necessary to see the bottom of your foot for this problem, but not sufficient. Can you talk about what other analytics could be applied to make this more usable than just visualizing the foot?
Well, visualizing the foot has been the gold standard that's been done for the last 30 or 40 years. Often podiatrists right now are just saying, just look at your feet. If you see anything different, come in, right? And so that's what's being used. I think that there are other companies out there trying to use thermometry and like heat mapping to determine if there's an infection or whatnot, but that doesn't always, it doesn't always work out the best, especially when like you come out of the shower or your feet are cold from being outside. So I think that you're really just looking for a change in the bottom of your foot. Does that answer your question?
Yeah, it seems like there's that change is quantifying the change is really important and not just capturing static images. And so I was wondering how.
Oh yeah, so we'll have the ability to look, especially, so our new prototype that's being pushed out today, actually, we're going to have the ability to look at yesterday's foot and view it with today's foot to see, all right, is a red dot showing there? Is my skin a little blue or red in this area? Do I have a cut on the bottom of my foot? So being able to look back is important.
Great.